Hello, this is Dr. Scott Berman. I am the psychiatrist for Holcomb Behavioral Health Systems in Allentown and Easton, Pennsylvania. Today I will be reviewing the safe use of benzodiazepine anxiety medications and the ways in which we will help you taper and get off of them. All of our patients are required to listen to this YouTube video and to sign a consent that they understand the rules under which we prescribe benzodiazepines safely. Benzos or benzodiazepines are a class of medications that are rapid-acting anti-anxiety drugs that have been in use for many years. They include Valium, Klonopin, Xanax, Ativan, Cerax, Restoril, and Librium. Generic names are in parentheses. They have different strengths or potencies, which is important to know. That is, somebody who takes Valium 10 milligrams will get the same effect from a very small dose of Klonopin 0.5 milligrams. Also important to know when we cross from one benzodiazepine to another or taper. Benzos are used for the short-term rapid relief of anxiety, to prevent alcohol withdrawal, for seizures, and as muscle relaxers. The benefits of benzodiazepines is that they have a rapid onset of action and can reduce anxiety in minutes to hours. They are reliable and work over and over again, and they are safe when used in proper settings. Risks of benzodiazepines. The risk we will talk about today is that they tend to cause and maintain chronic anxiety, and we'll show you how this is so. In addition, there is a risk of addiction, withdrawal, falls, car accidents, memory problems, and a risk of congenital birth defects if used during pregnancy. Let's talk about the cycle of anxiety. And this cycle goes whether or not this is social anxiety, panic attacks, phobias, PTSD, or obsessive compulsive disorder. Maladaptive beliefs that there's something dangerous that most people do not find dangerous lead to automatic thoughts when one is triggered. A trigger can be feeling your heartbeat fast, or a social situation, or a phobic stimulus such as heights or snakes or planes. The automatic thoughts lead to hypervigilance or scanning for danger, which leads to anticipatory anxiety, wondering when the danger will hit again. This leads to the all-important safety behaviors, things we do to make ourselves feel safer, which give us temporary relief, but the fact that we use safety behaviors makes us feel less safe and fuels the maladaptive belief that we are in danger all the time, which keeps us on the cycle indefinitely. Maladaptive beliefs include things like overestimating the probability that something bad will happen, or overestimating the extent of catastrophe if it does. People with anxiety have poor tolerance of uncertainty. They're very afraid even if something is unlikely to happen. They have difficulty with coping skills and often worry instead of solving problems, and they believe that the anxiety itself is dangerous to them. Triggers are different for different kinds of anxiety. Panic attack patients become triggered when they feel their heart beating fast or shortness of breath, dizziness, or sweats. People with social anxiety get triggered by social situations as well as their own internal responses such as sweating, blushing, rapid heartbeat. People with generalized anxiety are triggered by things in their everyday life: schoolwork, homework, bills, job stressors, because they worry incessantly and feel they're going to fail in every area. People with PTSD have triggers that either are the people, places, and things that are associated with the original trauma, or the memories of the trauma itself, so they try not to remember. People with OCD are triggered by the obsessional thought that if they don't do something that is their compulsion, something bad will happen. And people with specific phobias such as heights, snakes, planes, and so forth are triggered by the phobic object or situation. The automatic thoughts are also specific to the kind of anxiety. People with panic attacks who start to breathe fast will fear they are dying or having a heart attack or going crazy. People with social phobia think that people are looking at them or they are making a fool of themselves. People with generalized anxiety feel that the worst will happen or they will fail. People with PTSD believe that they're in danger, the world is not safe. People with OCD think that if they don't do their compulsion, something bad will happen. And people with specific phobias find danger in a specific object or place. Hypervigilance is scanning for danger so that most of your mind's attention is on looking around the environment to see when the threat will come. And the anxiety is not the fear at the situation, but the anticipatory anxiety, worrying about future panic attacks, worrying about going to a social situation, and so forth. Safety behaviors are things we do to prevent or reduce the threat or threat of anxiety. They fall into five kinds. Avoidance, which we see all the time, not going to the store, not going to parties, not doing certain kinds of homework because we're afraid that the catastrophe will happen or we won't be able to handle it. Checking our stoves, our locks, our car doors, emails, homework, etc. Mental maneuvers such as reassuring ourselves or distracting ourselves. Safety aids, very important for us, taking a benzo before doing something, carrying benzos in our pocket, bringing a companion, keeping food and water and so forth in our car to be safe. And reassurance, repeatedly asking for reassurance from a doctor, companion, boss, etc. Real safety behaviors are things that actually improve our lot in life, such as locking our door to our house at night, wearing a seatbelt in the car. These are false safety behaviors. You don't need to check your locks 5 times or read your homework 10 times over. You don't need to carry a benzo with you or bring somebody with you to be safe in a store. So when we do these safety behaviors, we're implicitly telling ourselves that we can't handle it on our own and things are not safe, which leads us to be more anxious. That's why benzos lead us to want more benzos, because we never gather the skills to feel that we can handle things on our own. Again, benzos worsen anxiety over time. They make us feel better very briefly, and we want them again because we want that relief, and that's negative reinforcement. They reduce anxiety, so they're habit forming. Misattribution of safety. We take a benzo before we get on a plane or go to a party, and we believe that the situation was tolerable because of the benzo. We take a benzo with a panic attack and think the reason we didn't have a heart attack is because we took a benzo. None of these are true, and they lead to loss of sense of self-esteem and self-efficacy. We continue to panic at parties or before we do things. They block threat disconfirmation. If you do the thing that you fear over and over again, in a way where you experience it and learn that you can handle it, you learn that there's no real threat. But if you never do it or only do it with a benzo, you don't learn that you could have handled it. And finally, it prevents the development of adaptive coping strategies. Again, the cycle of anxiety. For a panic attack patient, you think you can't handle things, or that you're always in danger. You're triggered by feeling your heart beat fast, which happens to everybody. Your automatic thought is, I'm dying, or I'm having a heart attack. You start scanning, checking your pulse, checking your blood pressure, going to the doctor, going to the ER. You develop anticipatory anxiety, where you spend a great deal of time worrying about the next panic attack. You develop safety behaviors such as taking benzos or keeping them in your purse or pocketbook. You get brief relief, but because you have not learned any skills and you believe that your safety is dependent on the benzo, your anxiety stays chronically high and you're trapped. Other benzodiazepine risks: overdose, especially with opiates or alcohol. And in fact, the state prescription drug monitoring program website now alerts us to anybody who's getting both opiates and benzodiazepines, and we discovered this because of the risks, including suppressing respirations or dying from overdose. Dependence is important, as is withdrawal. Don't stop your benzo suddenly. It can be very dangerous. You might get sick. It could be fatal potentially. Benzos are always tapered. Fatigue, memory and cognitive problems, especially in older people. Worsening of post-traumatic stress disorder symptoms. Worsening of chronic obstructive pulmonary disease or sleep apnea. Falls, especially in the elderly. Car accidents. You can get a DUI for using benzos and driving if you get into an accident. And birth defects, especially cleft lip and cleft palate in women who use it during pregnancy. So this cartoon, which I really like, says, okay, maybe I need to change my life, or maybe you could just tweak my medication. And all too often, people who have been used to using medication for many years simply want an increase in their benzo or a switch in benzo, not realizing that we have much better treatments for anxiety than benzodiazepines. It is more difficult and more work, but the outcome is better. As we get you off benzos, by replacing it with coping skills and desensitization through exposure, your anxiety will go down and your benzo use will both go down. The alternative medications to benzos are SSRIs such as Lexapro, Prozac, Zoloft, SNRIs such as Effexor or Cymbalta, Buspar, hydroxyzine, and gabapentin. None of them work quickly, although hydroxyzine and gabapentin might work a little faster. But once you're on them for a while, there should be a net decrease in anxiety, net decrease in panic attacks, improvement in social phobia. Cognitive behavior therapy is the best known and best studied technique for reducing chronic anxiety. Anxiety management skills is learning to cope with the anxiety, but it doesn't really take it away. And relaxation training can lower your baseline anxiety and be a good add-on. Cognitive behavior therapy is based on understanding the process, as we've explained it today, changing your cognitive distortions so that you have a reasonable expectation of the probability of something bad happening, which is always lower than you think. Exposure therapy is the core, and we'll go over this next, and relaxation techniques to reduce your baseline anxiety. Exposure therapy is based on the idea that if you do the thing that you fear in a hierarchical way, that is starting with simple, low anxiety tasks and working your way up, when you get through them, you have learned something and you have retrained your brain so that you will be less anxious because you will have inhibitory beliefs that counteract your long-standing anxiety beliefs. Exposure can be done imaginatively by describing or recalling the feared situation to your therapist. Interoceptive exposure for panic attack patients involves evoking the feared sensation. That is, we would have you run in place to get rapid heartbeat, breathe through a straw or hyperventilate to feel shortness of breath, and spin in a chair to feel dizzy. This is quite safe, and as you learn that you can bring on and off the sensations, you also learn that the sensation does not mean catastrophe. And finally, in vivo exposure is exposing yourself to the feared situation in real life. Successful exposure depends on preparing to feel anxious during the exposure instead of avoiding it. Leaning into it. Don't try to distract yourself. Deal with the anxiety knowing it will go away. No safety behaviors. When you practice something you've been fearful of, don't bring a friend, don't take a benzo. Be present, that is, pay attention to what's going on around you so you can have threat disconfirmation, realizing that there's no real danger. For example, should you get on a plane and you have a fear of flying, and you have several drinks, clutch your partner's hand and say the rosary and watch the wing to make sure it's not bursting into flames. When you land, you will be no less afraid than when you started. You haven't learned anything. You paid attention to your own dialogue that is dangerous. However, if you don't take any medication or alcohol and go by yourself and pay attention to the in-flight movie, talk to other people, notice that the people around you, including the flight crew, are not anxious, you realize that you may be overestimating the risk, and you will learn something, and the next flight will be easier. And you need to practice. Exposure works because your anxiety comes from being conditioned to become anxious to something that's objectively not risky to most people. The processing indicates to you that the risk is less than you believe, and again you develop inhibitory learning and extinction or fear response goes away. It is very effective across all anxiety disorders. Finally, benzo use, our expectations at Hokum. All of our patients will engage in efforts to taper gradually. All patients will work on alternatives, especially non-medication alternatives. Therapy clients must continue therapy. That is, you cannot be released to medication only until you are either off benzos or using less than daily, or a team agrees that you are on the lowest effective dose and there's no further alternative. Med-only clients will be required to taper with prescriber's assistance and use their own resources to reduce anxiety or start therapy to learn the treatment of anxiety. The benzo use rules on the consent form which you'll be asked to sign. You may not get benzos from any place except Hokum prescribers. You must take the medication as prescribed. You may not take other sedating medications or alcohol with this. If you use benzos and opioids together, it could be drowsiness, loss of respiration, or life-threatening. Narcan or naloxone will not reverse the effects of benzos. Don't suddenly stop your benzos. Discontinuing suddenly can cause potentially serious withdrawal symptoms. You must attend regular appointments. You must attend the prescribed treatment, including therapy. There will be no early fills or replacement supplies if you run out too soon or you lose your medication. We may ask you for a urine or blood drug screening sample or a count of pills at any time. Further refills and prescriptions will not be given if you do not follow through with this. You may not use illegal drugs while on these medications. If you are pregnant or intend to get pregnant, notify your prescriber immediately. You must let us know if you're on methadone, Suboxone, or opioid pain medications. You must give consent so that I can share information with other healthcare professionals, most especially if you're using opiates. We will send a informational letter to the opioid prescriber to coordinate your care so that the combination is used safely. The taper or GDR, gradual dose reduction, will be done under medical supervision. We will keep you safe. We will not put you into withdrawal. We will work hard to help you manage anxiety on your own. Remember, the goal is not less medication. It's less medication leading to less anxiety, not more so. Because as you learn, benzos keep you in the cycle of anxiety. As we reduce them and you gain skills, your anxiety should go down and hopefully not return. One more cartoon for you. And then remind you that after completing this video, you should ask the CSS or prescriber for a benzo consent form. We need to have your sign, your name, date, and write down the word benzo on the form, which tells us that you watched this video until the end. Thank you very much.